All right, and welcome to Unit 3. Today we're going to talk about viruses and prions. So let's get started. So you might be asking yourself, what exactly is a virus? A virus contains RNA or DNA at a very minimum and a capsid. This is a protein coat. They're 10 times smaller than bacteria, and they can't survive without the use of a host cell of some sort. They are tiny particles of nucleic acids and protein coats that are not really alive. The genome and the coat together are called the nucleocapsid. The entire virus particle is called the viron. The taxonomy of viruses is classified by genome strand, family, genus, and species. For example, the genome would be double-stranded DNA, the family would be herpes viridae, the genus would be cytomegalovirus, and the species might be human herpes virus 5. They cannot reproduce independently, so a bacteriophage will inject its DNA into a cell and uses the cell's metabolic processes to replicate. For viral replication to occur, the virus first must get into the host cell. They gain entry to the host cell via host cell endocytosis or via a bacteriophage. Cell enzymes uncoat the virus, releasing its DNA or RNA. The genome multiplies through translation and transcription. New proteins in the genome will form new virus particles. Since viruses cannot reproduce independently, it can inject its DNA or RNA into a bacterial cell and hijack its metabolic processes to replicate. That's what happens in a bacteriophage. Let's talk about the lysogenic and the lytic cycle. The lysogenic cycle is when a virus is infected the host cell and the genome is kind of mixed up in this genetic soup. The viral genome gets copied until conditions are right for replication. That's called the lysogenic cycle. When the virus takes over the metabolic machinery of the host cell, this is the lytic cycle. What exactly is the optimal environment for a virus? Well, that's kind of unclear. Some viruses live in the environment for hours or days, but some fall apart right away. Soaps, detergents, and alcohol do a good job at breaking down the capsid of viruses. Many experiments have been done to figure out the optimal environment for a virus. Factors such as temperature, humidity, ultraviolet light, these things affect various viruses in different ways. There's no way to make broad generalizations about what the optimal viral environment is. So to cause an infection, a virus must come in contact with the susceptible host cell. There are many portals of entry. Mucous membranes of the respiratory tract. I think of diseases like influenza A, measles, and mumps. Mucous membranes of the gastrointestinal tract. I think of hepatitis A, polio, rotavirus, and those types of viruses. Mucous membranes of the genital tract. I think of human papillomavirus, herpes, HIV. Animal and insect bites is another way that a virus can come in contact with host cells. And I think of things like Ebola, dengue virus, and West Nile virus. A virus can get inside of a host cell through organ transplants. Hepatitis B or HIV are examples of those types of viruses. And then finally, there are some viruses that can actually cross the placenta, and viruses that can cross the placenta are CMV, measles, and Zika virus. Let's go ahead and talk about a few of the viral pathogens. I first want to start by talking about adenovirus. Adenovirus is a virus that causes gastroenteritis in children. It also causes acute pharyngitis, conjunctivitis, and acute respiratory disease, pneumonia, and things like that. It is a double-stranded DNA virus. The viron is non-enveloped, spherical, and approximately 70-90 nanometers in size. The herpes virus is a pretty common virus among animal population. Approximately 100 strains of herpes virus have been identified, and they belong to the family Herpes viridae. Oral herpes is usually caused by herpes simplex 1 virus, and genital herpes is usually caused by herpes simplex 2 virus. Herpes can also cause ocular herpes and herpes disease of the cornea, which would be called viral keratitis. CMV, or cytomegalovirus, can invade nearly every type of human cell and can become the cause of liver failure, retinal inflammation, and colitis. Women can easily pass the virus on to the fetus during pregnancy. The cytomegalovirus causes a systemic infection, especially in immunosuppressed people. Oftentimes it causes a fever and splenomegaly. It's estimated that 90% of the world's population has been infected with the Epstein-Barr virus, which is the virus that causes infectious mononucleosis. In fact, 50% of the time, the Epstein-Barr virus presents as mononucleosis. There is an established connection between Epstein-Barr virus infection and nasopharyngeal carcinoma and Burkitt's lymphoma, which is a high-grade B-cell lymphoma that occurs in the equatorial Africa and New Guinea regions. Infection by varicella zoster virus typically occurs during childhood, resulting in the disease commonly referred to as chickenpox, or it can develop into what's known as shingles. There's 100 types of human papillomaviruses. Some cause genital warts and are associated with cervical cancer. Condylomata acuminata is a condition of anogenital warts. Strains 6, 11, 16, 18, 45 are considered high risk for cervical cancer. Viridae, a pox vivae virus, causes smallpox and has been eradicated, but the vaccine, which ended in 1972, is only good for about 10 years, so most people are susceptible if a new outbreak were ever to occur. In 1981, researchers at the CDC came to the realization that a new epidemic called acquired immune deficiency syndrome, or AIDS, was spreading rapidly in the United States. The most noticeable characteristic of the new disease was vulnerability of those who are infected to opportunistic infections with a profound decrease in their T lymphocyte counts. The Bandivividae are associated with arboviruses, and one arbovirus is called hemorrhagic fever. But other arboviruses are called lacrosse fever and hantavirus. Hantavirus, of course, is associated with the deer mouse. Hantavirus pulmonary syndrome is how one can develop the disease hantavirus. They usually have fever, tachycardia, hypoxia, and hypotension. Norovirus is sometimes called Norwalk-like virus, or sometimes it's called the winter vomiting disease. It's the most common human viral gastrointestinal disease. There are 23 million cases every year in the United States. This is the one that's associated with cruise ships. And then finally, the coronaviruses leads to severe acute respiratory syndrome, or SARS. In 2002, there was a pandemic affecting 26 countries with a mortality rate of about 10%. There was actually about 8,000 people that were infected. In 2012, Middle Eastern respiratory syndrome was another type of coronavirus. And of course, now in 2021, we're dealing with the coronavirus epidemic as well. The Filovividae are the Ebola viruses, named after the Ebola River in the Congo. They first emerged in 1972 in Sudan and Zaire. They are characterized by hemorrhagic fever, diarrhea, and vomiting. The Flavividae are associated with dengue fever, yellow fever, and Zika. The Orthomyxovidae are the influenza viruses. They're divided into three groups: influenza A, influenza B, and the one you don't hear of too often, influenza C. Types A and B cause seasonal outbreaks in human populations and are constantly mutating. Type C, on the other hand, causes a mild upper respiratory type of infection and is not believed to cause epidemic outbreaks. The paramoxovividae are the parainfluenzas, measles, mumps, and RSV. It's divided into two subspecies, the paramoxovivirine and pneumovivirine. Under the paramoxovivirine subfamily, genus Paramoxovirus includes the human parainfluenza viruses 1 and 3. Also, mumps is a common acute disease primarily caused by this family of viruses as well. Also, RSV is caused by this family of viruses as well. So this brings us to hepatitis, and hepatitis is caused by two types of things. There's non-infectious hepatitis, which is caused by toxins and pharmaceutical agents such as alcohol, medications such as herbal medications, and regular medications like acetaminophen. And then there are infectious agents that cause hepatitis, and those are hepatitis A, hepatitis B, hepatitis C, and there's a few others as well. It's primarily a virus that attacks the liver and no other organs. There's very little effect on other organs. Let's go ahead and outline the hepatitis viruses, and we'll start with hepatitis A, also known as HAV or infectious hepatitis. Outbreaks have been linked to ingestion of raw seafood from water contaminated with human waste. There's a short incubation period, and usually it's about 15 to 50 days. The spread is fecal-oral route, and it is a single-stranded RNA enterovirus. It is associated with overpopulation situations, or it's associated with crowds of people, or people who use contaminated water sources. There's an abrupt onset of this viral disease, and it has a mortality rate of 0.3%. In the United States, there's about 125,000 to 200,000 infections a year, although in the U.S. that rate is decreasing. This leads to about 100 deaths per year. This type of hepatitis typically isn't fatal. The symptoms of hepatitis A virus can usually start to develop about 2 to 6 weeks after exposure, and there's an acute onset of these types of symptoms: fever, anorexia or loss of appetite, right upper abdominal pain, nausea, and about 70 to 80% of the people that have hepatitis A have jaundice. The incubation period is about 15 to 50 days. The virus can actually be seen in feces of the infected individuals by electron microscopy 10 to 14 days before the onset of the disease. Hepatitis B virus is also known as HBV or serum hepatitis. It is a double-stranded circular DNA virus, and it is one of the most common human pathogens. It's best known as a form of post-transfusion hepatitis or hepatitis associated with the use of illicit drugs. It has a longer incubation period than hepatitis A. Usually the incubation period is around 45 to 180 days. It is associated with sharing needles, blood transfusions, sexual contact, blood and body fluid contact, and it can actually go from mom to baby. The incubation period is about 4 to 12 weeks, and the mortality rate is 0.5 to 1%. There's about 300 million hepatitis B carriers worldwide, and about 5,000 people in the U.S. die every year due to liver disease associated with hepatitis B virus. Hepatitis B is about 100 times more infectious than HIV, and it can cause a broad spectrum of liver disease and a gradual onset of fatigue, joint pain, right upper quadrant pain, nausea, and jaundice. The symptoms are more severe than those of hepatitis A, and recovery is slow, and it may develop into chronic hepatitis. This brings us to the hepatitis C virus, or HCV. The old name used to be hepatitis non-A, non-B. It's the most common blood-borne virus in the U.S., with 3.9 million people in the United States that have hepatitis C. It's a major source of hepatitis among dialysis patients and is transmitted by needle sticks, transfusion, human bites, tattooing, body piercing, and sexual intercourse on rare occasions. It has a long incubation period of about 2 to 26 weeks, and the mortality rate is 0.2 to 0.4%. 85% of people that have hepatitis C become chronically infected, and about 30,000 people in the U.S. become infected every year. The World Health Organization estimates that 3% of the world's population has been infected with hepatitis C virus. Generally, hepatitis C virus is a mild disease with an absence of clinical symptoms. Hospitalization is usually not required. Some symptoms of hepatitis C virus would be jaundice, fatigue, nausea, or the patient could be asymptomatic. There is currently no distinction between acute or chronic hepatitis C virus diseases. Hepatitis E is a single-stranded RNA virus and was first discovered in 1990. It has an abrupt onset similar to hepatitis A, and the virus is only identified recently in 1990. It has a 15 to 60-day incubation rate, and the risk of becoming chronically infected is questionable. The mortality rate is about 1 to 2%. Hepatitis E virus is endemic in tropical and subtropical countries such as India, China, and Africa, and it's fatal about 2% of the time. Hepatitis D is also known as delta agent hepatitis, and it was first discovered in 1977. It's a small circular RNA virus found only in people that are infected with hepatitis B virus. There's a 21 to 90-day incubation period, and usually people get hepatitis D from blood and body fluids. It's most associated with IV drug abuse, and about 20 million people have hepatitis D virus. The mortality rate is quite high at about 20%. But the hepatitis B vaccine will also prevent the development of hepatitis D. Hepatitis G was first described in 1996. It is considered to be a blood-borne agent, and 1 to 2% of blood donors may actually have hepatitis G. It's typically only problematic for people who are immunosuppressed. It frequently occurs as a co-infection with hepatitis C virus. Does not appear to cause a clinically important liver disease, and the role of hepatitis G seems to be unclear. There's no specific treatment, and the prognosis is good for those who have it. The illness is mild, doesn't last very long, and doesn't cause long-term liver damage. AIDS, or acquired immune deficiency syndrome, is what we call a primary disorder of the T cells. There's extensive destruction of T cells that leads to a gradual depletion of the CD4 type of lymphocytes. Patients are prone to opportunistic infections such as pneumocystis carinii, Cryptococcus, neoformans, and Kaposi sarcoma. HIV can be isolated in blood, semen, that's where the highest concentration is, and also breast milk. It is transmitted by blood, blood products, dirty needles, semen and vaginal secretions, from mother to child, tissue transplants, but it's not transmitted by casual contact. In fact, there's no evidence that it can be transmitted from saliva, or has it been isolated in the saliva or tears of patients. There is no evidence of mosquito transmission, and no evidence that it can be transmitted by the hepatitis B vaccine, which is also made from human plasma. Populations that are most at risk for developing human immunodeficiency virus are people with multiple sexual partners, intravenous drug users or people that share needles, patients receiving multiple blood transfusions, people that get blood and blood products, but those blood products are tested for the virus, hemophiliacs, and those are people being treated with factor VIII, infants born to mothers of the above group, and also healthcare workers. Clinical manifestations of HIV are actually opportunistic infections, and those opportunistic infections can be bacterial, fungal, protozoan, viral, or neoplasms, which is a fancy word for a new or abnormal formation of tissue or a tumor. Some bacterial clinical manifestations would be Mycobacterium avium intracellular. Some fungal manifestations could be Cryptococcus, candidiasis, histoplasmosis. Some opportunistic infections with protozoans could be Cryptosporidium, pneumocystis carinii, toxoplasmosis. Some viral infections would be herpes simplex complex and CMV. And then some tumors that these patients are prone to would be Kaposi sarcoma, and they can also have peripheral organ lymphoma. The HIV virus is a retrovirus and contains a single strand of RNA. It contains an enzyme known as reverse transcriptase, and this enzyme, reverse transcriptase, actually enables the virus to convert RNA to DNA. This reverses the normal process of transcription where DNA is converted to RNA. Therapy for treating AIDS patients is changing virtually every day and improves almost every day. But basically, we want to follow these principles when we're doing therapy for AIDS patients. We want to block the binding of the viral envelope. We want to keep viral RNA and reverse transcriptase from escaping their protein coat. We want to inhibit transcription of RNA into DNA, block translation of RNA into viral proteins, prevent modification of viral proteins, and prevent the virus particle from assembling itself and budding out of the cell. One drug that's used to treat HIV patients is AZT, and it actually inhibits reverse transcription of RNA into DNA. However, this drug can be toxic to the bone marrow. There has been some talk about developing a vaccine, but it's difficult because the virus infects some of the same cells that would be used to make a vaccine. Also, some other obstacles to vaccine development would be that the virus attacks the immune system, the infection spreads to the central nervous system, and maturation of the virus is also a factor that is preventing us from developing a vaccine. There are many cancers associated with viral infection. For example, Epstein-Barr virus. Epstein-Barr virus, or the herpes virus, is spread through the saliva and can lead to Burkitt's lymphoma and stomach cancer. Burkitt's lymphoma is a form of non-Hodgkin's lymphoma. It's basically B-cell tumors. The HBV virus, hepatitis B virus, is spread through blood and body fluids and can lead to liver cancer. Also, hepatitis C virus can spread through the blood and lead to liver cancer. HIV spread through semen, vaginal fluid, blood, and breast milk can lead to Kaposi sarcoma, although indirectly. And then human papillomavirus, or HPV, can lead to cervical cancer, throat cancer, penile cancer, and vulvar cancer. There is a vaccine for hepatitis B virus, and there's a vaccine for the human papillomavirus. Now, prions aren't exactly a virus. They're actually a proteinaceous infectious agent, and they can lead to things like Creutzfeldt-Jakob disease and chronic wasting disease. Both of these are considered transmissible spongiform encephalopathy diseases. Viroids may be ancestors to modern viruses, and most cause disease to food crops like potatoes, tomatoes, and coconuts. One of the most important things we can remember as healthcare workers is how to avoid viral exposure or how to avoid viral infection. And there's a number of ways that we can do that. We can minimize potential exposures. For example, we can wear face masks or implement respiratory hygiene and cough etiquette. We can implement engineering controls. In other words, install physical barriers from viruses, provide good filtration, good air exchange in heating and AC units. We can monitor and manage others who have been exposed. Personnel should report any signs or symptoms and implement sick leave policies. We can properly train and educate personnel. We can ensure infection control practices by using hand hygiene and wearing PPE. And we can also implement environmental infection control, making sure that cleaning and disinfecting procedures are all followed consistently. So this brings us to the end of another lecture. It actually concludes our discussion on viruses, viroids, and prions. If you have any questions, you know how to get a hold of me. Have a great day.